Dr. Louise Blair, Head of Vaccines and Epidemiology at Airfinity, a health data and analytics company. Dr. Louise, thank you very much. We want to understand from you the COVID-19 scare that we have yet again 3 years on. China is really exploding, their health infrastructure maxed out. US is fearing a surge in their country. India is, of course, currently preparing itself. Tell us, should we be worried?
Well, I think what we're seeing in China is a real increase in cases. They've dropped their zero COVID policy, and following which we're seeing a real surge. And these cases aren't being officially recorded, but what we are seeing is indications in media reports that hospitals are being overwhelmed, and also that there's a significant number of deaths. Now, as always with a large surge in cases, there's always concerns over a new variant emerging from the region as well. So countries such as India are preparing in case any new variants reach their shores.
You know, Dr. Louise, what's your take on herd immunity? I know UK tested it at one point, even though China wasn't really willing to practice herd immunity. It appears now with your health infrastructure maxed out, they have no other choice but to try herd immunity.
In terms of the rate of cases that is occurring in China, from what we can get from indications from media reports, it may be really too late at the moment to ramp up vaccinations in order to significantly make an impact. We know China has been very successful in order to ramp up vaccinations within the country. We've seen a peak of 22 million vaccinations a day, but unfortunately we think that that's too late now, and by the time that they could reach that level of vaccination, the cases may have already at least had one peak within the country. So in terms of measures that China could implement to help slow the impact, it would really be other measures such as, again, going into lockdown, restricting movement and mixing in order to control that number of cases at the moment. Now, of course, with a significant number of people being infected, there will be individuals getting protection, natural immunity. However, there will be the most vulnerable still getting severe disease and risk of death. So while a large majority of the population could get protection via herd immunity, unfortunately, it would mean there would be a significant number of deaths in the meantime.
Right. Dr. Louise, a quick word on, since you mentioned vaccines, of course, India has really ramped up its vaccination drive, and we've really achieved it successfully. Our booster shots, would you give any kind of importance and prominence to a booster at this point in time with the new variant?
Well, we have seen with boosters that can raise protection within a population. Unfortunately, with the vaccines, over time, the protection does wane. And therefore, in order to really ensure protection levels within a population remains high, boosters can offer that protection and achieve that.
Right. Dr. Louise, would you have a word on the new variant that's really driving the surge in China right now, the BF7? It appears there are 4 cases that have been detected in India also. What kind of symptoms do we expect, any different from the first few variants that came up?
Well, with variants, unfortunately, there's limited data coming out from China. So while it is suspected there may be BF7 circulating, there could also be other Omicron subvariants. Now, within a protected population, within countries that have achieved high levels of vaccination, we have seen Omicron and Omicron subvariants appear more mild, sort of fewer people getting severe disease. But of course, in China, the levels of vaccination, particularly boosters, and the individuals have had significant time since they've had a booster dose. That may be different within that population as well, so more severe disease still occurring with this Omicron subvariant.
If you like the video, do like, comment, share and subscribe.